See that little spot there? It's kind of whitish.
Dentists may be trained to perform oral cancer screenings, but some may not do them as thoroughly or regularly without the patient asking. Please ask during your routine exam. Early detection of oral cancer significantly improves the success rate of treatment.
We're measuring the white spot. If it's bigger next time, and he comes back in 3 or 4 months, then we know there's a problem.
Oral cancer screening is the standard of care, yet people may not think that they have a problem.
Do most people even are they aware of what's going on in their mouth like that?
No, especially under the tongue.
The dentist's exam is quick and easy.
So I've got the tongue and I'm looking at it here. I've got excellent lighting. Turn it straight up a little bit. And then I'm going to switch sides.
According to the American Cancer Society, incidence of oral cavity and oropharyngeal cancers have increased at a rate of 1% per year since the mid-2000s, mostly because of a rise in cancers linked with HPV, the human papillomavirus. At UC San Francisco, head and neck oncologist and surgeon Dr. Mary Hsu says while there is no formal screening for HPV oropharyngeal cancer, UCSF holds annual community screenings every April during Oral Head and Neck Cancer Awareness Month.
When a patient comes in, we'll do a screening questionnaire to see if they've had any complaints that are related to lumps or bumps or pains in the head and neck cancer area. And then we'll do a thorough head and neck exam on them.
What does that exam look like? What do you actually do? Because I think a lot of times people are hesitant. They don't understand what it is.
Yeah, for sure. The exam actually looks very common to, I would say it looks pretty similar to some of the published self-exams, such as through the Head and Neck Cancer Alliance. So they have tools for people to actually perform their own exams. But more or less it involves kind of looking in the mouth, seeing if there's any lumps or bumps, feeling the side of the cheeks, feeling the neck to see if there's any lymph nodes at all. And so that's mostly the big pieces of looking around, feeling to see if there's any abnormalities at all. But for anyone we find any findings, we have a form that will actually write almost like a letter to their primary care doctor of hey, we saw so-and-so at the screening clinic, we noticed this. We would generally recommend they see, additional ENT care or maybe get a biopsy or whatnot. So we don't do the scopes. But if someone needed a scope, we may write that down as a formal recommendation for them to then see an ENT and get connected to care. Some of the work that I'm trying to develop or that we're interested as well is how do you create more expedited systems in the US and internationally to help triage patients a little bit better. I would say on the head and neck cancer side, for instance, there are different groups around the country that have looked into different interventions to help expedite all these delays in head and neck cancer care. Some of those are, for instance, trying to bring all the multidisciplinary team together on one day. So when a patient comes in, they can see everyone at once. Other ways people are tackling it is through patient navigators of helping accompany patients through all the different appointments and the care. But it certainly is still a really big challenge of getting patients to the right care at the right time without delays.
Dr. Hsu also supports HPV cancer prevention campaigns with a dramatic twist.
I think if there needs to be some campaign to show people what head and neck cancer looks like, because as you probably know and have experienced, I think, I've had family members have breast cancer and other cancers as well. But there's something about head and neck cancer that I think is just it's really unique compared to cancers. You just can't hide it. It affects every interaction you have. It affects being able to sit down and eat with someone and have that social connection. It prevents you from feeling like you can walk outside really comfortably and being around people. There's just such a profound effect on how people live and their lives that to your point of saying if people knew that you can have a vaccine and prevent cancer, I think that would be great. And I think to add on that is if people understood how life-changing and sometimes debilitating head and neck cancer is, if that knowledge would push people further.
Ask your dentist for an oral cancer screening or attend a screening event. Early detection is the best way to beat HPV throat cancer.